Hi Mom, and welcome back to this video. So a couple of things today. Number one, this is the first video I'm starting off with no makeup. So we love imperfections. Imperfections are beautiful. Got my pale skin and my acne scars because anyone that tells you that you're not gonna have acne when you're an adult is a liar. But anyway, also a little bit of a change. My hair is purple. The last, all of the videos I've done, my hair has been dark green and now it's purple and I cut off several inches. So I'm really excited about that. Today, I'm gonna be trying a different kind of video. Would it really be a Looks by Lily video if I didn't burp? If I didn't nervously burp? Okay, today we're gonna be trying a different kind of video. I suggested in my last Get Ready With Me video, I may wanna try something called makeup and mental health, which is just where I'm gonna be doing my makeup while talking about a mental health topic. And I got a couple of people saying that they thought that would be a good idea. So I thought I would try it and see how people like it and if it's interesting, because I think watching someone do their makeup can be really cathartic. Kind of like Bailey Sarian does that makeup and murder mystery thing. It's really cathartic to watch her do her makeup and then she's talking about a really interesting topic at the same time. Also, my hands are purple. That's what I'm gonna do today. So we're just gonna get ready together. I've got my morning coffee. First things first, I'm gonna use this ColourPop Pretty Fresh foundation. I just squirt a few pumps on the back of my hand and then take my little brush. I'm just gonna whack this all over. I already ran some brow gel through my brows, so this should be good. But we're just gonna buff this on. Okay. So makeup and mental health. Let's start with a little bit of why I wanted to do this and some disclaimers. So I work in mental health. It's on my Facebook profile if you're my Facebook friend, but a lot of you may not know what my job position is, and I am a hopefully soon to be certified peer support specialist, which is basically somebody that has lived experience with a mental health disorder or mental health disorders or substance abuse disorders or both, and we work within the mental health system to give support to other people with our same disorders and our same predicaments. So I consider myself to be in recovery, and my job is to help other people with mental disorders, help them in their recovery and help them set goals and just realize that a future is possible when living with a mental health disorder. So that's what I do for a living. My credentials are pretty much my lived experience. So I don't have a degree or anything like that. So I'm gonna disclaim this video by saying I'm gonna be talking about obsessive compulsive disorder today. And my experience is all of the research that I've done in my own time, watching videos and reading articles and looking up symptoms, talking to my therapist and my psychiatrist. But I am not a doctor or a clinician. I am just a person who is diagnosed with obsessive compulsive disorder. So I'm going to be talking about the disorder, but this is going to be from the perspective of somebody who has it, not somebody who has studied it excessively, if that makes sense. So, and now I'm just whacking on some concealer. I got my real veiny eyelids here. Whoa, she pale. Let's start with a bit of my obsessive compulsive disorder story. I was diagnosed like only a month or two ago, but I have had obsessive compulsive disorder since I would say I was probably 16 or 17 is when the onset started, and I just hadn't known what it was or gotten it diagnosed until recently. So with OCD, there is a big stigma or a big generalization that comes with OCD, which is that we're all clean freaks, we're all super organized, and that it's just a fun little personality quirk to be that way. So you'll constantly see people who are color coding binders or, I don't know, alphabetizing their books, and they'll say, oh, I'm so OCD. But they don't really realize that they're attributing their just neatness and tidiness to an actual very debilitating disorder. Okay, we're gonna put on some powder. My first episode, I was in school, and I don't really want to talk about the topic because some OCD obsessions can be really upsetting and it could be kind of triggering to relive it. But there was something that I was uncomfortable with that I became very, very obsessed with. And when someone with OCD says that they're obsessed, they don't just mean like interested or kind of into it. They mean obsessed. Like you cannot sleep, you cannot eat, you cannot think about anything else. My grades would slip. I became so obsessed with the topic of my obsession that I couldn't do anything for months. I was debilitated for months until eventually it stopped. So that was my first kind of experience with OCD, and it was really scary. And I didn't know what it was. I didn't know what was happening to me. I didn't know how to communicate to other people that this was happening to me. And with OCD, most people have obsessions and compulsions. So the obsession is whatever gives you anxiety that you're currently fixated on. And the compulsion is some physical or mental thing that you do to relieve that anxiety. For me, I don't have many compulsions. My compulsions are more mental. So like repeating words all over and over again in my head, or sometimes I would like ritualistically touch things, like I would wear a cross necklace that I would like have to touch. But for the most part, my OCD has been very obsessional. And there's a nickname for that isn't necessarily, I don't think, totally medically recognized, but it's very recognized in the community, which is the term pure OCD, which means that you're on the side of being very obsessional and not so much on the side of having a lot of compulsions. So that's the type of OCD that I have. So every time that I have an episode, it's something that I'm debilitatingly obsessed with. So my first episode was in school, and that lasted probably about 2 months. And I didn't really get any help for it because it wasn't something that I knew how to communicate, that I knew how to tell somebody. Like I would try and talk to people, but it would just sound like I was obsessed with one subject. It didn't really sound like a problem because you don't know how scary and how painful it is for the sufferer at that time. I'm gonna go in with this little ColourPop Sailor Moon palette, do a little pastel purple moment. But yeah, it's really something that's very hard to explain. And I had several other episodes throughout the years. Like one episode that I have had is under the umbrella of something we call scrupulosity in OCD, which is a religious obsession. And so I was very obsessed with the thought that I was going to hell. I was convinced that I had done or said something blasphemous and that I was going to hell. And so for weeks, that was my obsession, is that my eternal soul was damned and there was nothing I could do about it. And I became just completely taken over by this thought because it's scary, because you truly believe these thoughts that are in your brain. And these kinds of thoughts are called intrusive thoughts. So everybody has intrusive thoughts. You might be driving down the road and see a bicyclist and all of a sudden it pops into your head, what if I hit them with my car? And that's an intrusive thought. Everybody gets them. They're weird. They feel random. They're not really thoughts that mean anything. You don't want them. They just pop into your head. And a person with a quote unquote normal brain would have that thought and be like, oh, that's scary. I don't like that. I'm gonna remove that from my brain and move on with my day. But a person with OCD will become obsessed with the thought. They're like, why did I think that? Am I an evil person? What is wrong with me? Do I want to hit somebody with my car? What if I don't want to hit somebody with my car? What's wrong with me? Did I already hit them with my car? And you become a little bit borderline delusional because you can think things happened that didn't happen. But the most important thing to remember, if you have anybody in your life that is dealing with chronic intrusive thoughts, chronic unwanted thoughts, is that they are just that. They are very, very unwanted by the sufferer. So if they're thinking about something that's kind of taboo or kind of dark, please know that if a person is diagnosed with OCD, they do not enjoy these thoughts. They are the bane of many of our existences, and we can't control them. There are treatments, and we can talk about treatments in a little bit. So that is a little bit about that. I'm gonna put a little bit of this tuxedo rose shade on the inner portion, so I want to do kind of a peachy moment. So anyway, I had my Scrupulosity episode where I was convinced I was going to hell, and eventually I got over that, but this is, remember, this is when I was not diagnosed and didn't know it was OCD. I also have had obsessions over the climate, like over climate change, where I reacted very harshly to bees dying or the ice caps melting, and I went down an obsessional rabbit hole where I was just consuming that content on YouTube. I quit eating meat because I thought it was gonna help. I have had just so many different types of obsessions. If you can think of something that you don't wanna be obsessed with, I have been obsessed with it. And it's very, very distressing. Recently, my medications got messed up thanks to a doctor who wanted to change all of my mental health medications. I had an OCD episode, and that's when I realized, oh, something is really wrong here. So I wrote down all the times I had been unnaturally obsessed with things. I wrote down all of the mental compulsions that I was doing, and I brought them to my old doctor and I said, hey, I don't think that this is normal, and I am having a very hard time. And then I finally got my diagnosis for OCD, which getting a diagnosis felt liberating. It felt like, I'm gonna take this yellow shade here. It felt like finally this wasn't my fault. I wasn't a freak or a weirdo. I just have a disorder that I can't control. And all of these obsessions, all of these thoughts are not things that I actually want to be thinking about. It's just how the disorder works. Like I said, the most important thing to remember is they don't derive any joy from their obsessions or compulsions. So even with that stereotypical type of OCD, which is around cleanliness and contamination, it's not a fun little personality quirk. It is miserable for the person that's going through it. They are so afraid of being contaminated that they have to do these compulsions, or they feel like they'll be compromised in some way. And that's a really hard way to live. Not that there isn't hope with OCD, because there is always hope, I believe. It takes time. It really takes time. So if you have someone in your life with OCD, I would just recommend doing as much research as you can on the disorder, on how obsessions and compulsions work, and what it feels like to be somebody with OCD. Because often we feel very alone and very isolated, and having more understanding for our disorder, I think, would help take some of that away. And there's already such a stigma with mental health. I'm gonna whack on some bronzer. That you can control it if you want to, or it's all in your head, or which I don't even know what that means. It's all in your head. Obviously, where do you think it's at? My ass? Like, it's my brain. Of course it's in my head. So yeah, that's what I would encourage people to do. And as far as treatment, now that I have my diagnosis, I already had several other mental health diagnoses. I've been told to say diagnoses. So I was already seeing a therapist and a psychiatrist, but now that I know specifically that I have OCD, I have specific meds that I take for it, which I'm not going to advertise the kind of meds I take for it, because different meds work for different people, and that's really something you should talk to a doctor about, and not me doing my makeup on the internet. But I did find a medication that has seemed to be working so far as getting rid of the intrusive thoughts and making me feel more like myself. I do cognitive behavioral therapy with my therapist, which I don't really know totally how to describe. I don't know, it just feels like traditional talk therapy to me, but my therapist told me that it was cognitive behavioral therapy, so I would look into that. Also, some people do exposure therapy. If your obsession is that you're afraid you're gonna hurt somebody, being around other people, getting comfortable being around sharp objects, because you're not going to hurt somebody. You don't want to hurt somebody. It's just the disorder. Or, you know, people with contamination OCD, maybe touching things they see as dirty. Like, I've seen therapists on like YouTube videos having someone touch like the inside of a toilet bowl. Touch the inside of a toilet bowl to expose themselves to the germs and to see that nothing bad is going to happen to them. There's also some other stuff that comes with OCD, dermatillomania or trichotillomania, which is either the uncontrollable urge to pick your skin, or the uncontrollable urge to pull out your hair. I personally don't have trichotillomania, but I do have dermatillomania, where I will pick my skin until it bleeds and get really like zoned in and kind of obsessed with doing that. There's also things that are adjacent to it, like having a hoarding problem can be related to OCD. It's really a varied disorder, what people are obsessed with. Let me put on a little bit of highlighter. I'm gonna go in with this shade Lace in the Rach Loves palette. Yeah, some advice before you say I'm so OCD, or even other disorders like I'm so bipolar. Really do your research, because people are suffering with these disorders, and the more that we trivialize them, the harder it is for the sufferer to actually be taken seriously. I would just always be mindful of your language, and it's not in a way to where I'm gonna tell you, oh, I'm so offended, or oh, you know, you're canceled because you use this language. It's nothing like that. It's just being mindful of who you affect by using certain words. When I tell people I have OCD, a lot of people kind of don't realize the severity of what it is that I'm dealing with, because they just don't quite understand. But that's why we do things like this. This is why we make videos like this, and to talk to people on a one-on-one level so that we can kind of learn more about each other and learn about neurodiversity and realize that people with mental health disorders are just people. I have a husband, I have my own house. Well, I rent this house, but it feels like mine. You know, I'm just living my life with my disorder. treating it one day at a time. And I would say if you resonated with any of this, if you are like listening to me like, holy crap, I think I might have OCD, please talk to a doctor. Please, please, please. Like, talking to a doctor changed my life. And I know that not everybody has access to the best medical care, which is completely understandable. It changed my life getting a diagnosis, and I feel like I understand myself so much better now. Let's do the bottom lashes, shall we? That's been a little bit about OCD and about my experience with OCD. I hope that came off coherently. And this video is gonna be a little bit vulnerable. I like to do funny videos, but we're gonna be a little vulnerable in this one. Let me spray my face with this cheap setting spray that I have. I do kind of like this though. Probably not going to put on any lipstick because of the mask wearing situation. So this concludes the video. What do we think of the makeup? I think it's a fun little bright pastel makeup. I'm gonna lean in a little so you can see it. Thank you for listening to this first episode of Makeup and Mental Health. Let me know if there's any topics that you'd like me to talk about. I do have other diagnoses, so I do have lived experience with several other disorders, as well as some professional experience with certain disorders. So let me know if you want me to talk about anything, or if there's another more broad topic that you want me to talk about in mental health. And I'll keep making these videos if you guys like them. So thanks for listening to me. Thanks for being here, and thanks for being a friend. Click like, click subscribe, leave me a comment, and follow me on Instagram. Bye, Mom. Seriously. Well, I just knocked over a picture, and all 16 of my chins came out when I did that. I was like, well, let me put on my mascara and we're gonna continue on.